When the pandemic hit, we were really worried about the children and families that we serve. There were a lack of resources, diapers, wipes, toilet paper. A lot of our families were losing their jobs. We serve families who are undocumented and did not qualify for some of the emergency assistance being provided at the time. People were losing family members and unable to gather for support, and were struggling.
I know the importance of human contact with our seniors who have dementia or our seniors that just simply live alone. So back in March, when we were informed by Illinois Department on Aging, Illinois Department of Public Health that we had to close the center, my concern was the lack of engagement, that they would regress in their diagnosis. And I didn't want that to happen to any of them.
I started working. It just started working. It was really crazy because it was like I was trying to cram up to trying to find a babysitter for my daughter. It was hard.
Our donors were very supportive. They were extremely understanding of the situation that Chicago Commons was practicing in and wanted to, actually, a lot of them called us, like, what else can we do?
Our team used emergency funding to continue providing support to families. We covered the cost of rent and mortgage, utility bills, groceries, clothing items, and so much more.
It was clothes, shoes, like transportation. It was help with, trying to hurry up and find an apartment. It was help with my furniture in my house. I believe without that, I would literally be probably sleeping on the floor.
Prior to the pandemic, a lot of our early education services provided on site were primarily based on our human interaction. So face-to-face contact and being physically present within our programming. When the pandemic hit and it was not feasible for us to do so, we had to think through an e-learning platform and begin to explore options for how we could continue to provide services and connect with families.
As for our seniors, we did e-exercise programs and conversation groups. I think Deliza also led a spiritual grouping with some of the clients as well. So we adjusted.
Monique loved this school. Talked about the teachers a lot. She talked about the kids a lot. Claudia made sure, she kept me up to date on when the centers was back open, how long they're going to be closed for.
We truly had to pivot our center operations in order to make it safe for children to return. We revamped our policies and procedures and made them specific for COVID-19. We enhanced our health protocol, but we were really strategic about it. We followed all of the CDC guidance and guidance from DCFS and other funders to make sure that we were creating the safest environment for children to return and staff.
Oh my goodness. The excitement, that is just a moment that you'll never forget. The joy in their eyes when they came to the facility. We're still practicing, of course, social distancing, and they're still wearing their mask. Activities are still in individualized containers. They're having a good time. They're being stimulated. They're happy. We're having fun.
I just want to say thank you so much to each and every donor that contributed during this time. Without the support that we received from you, we wouldn't have been able to adequately support our families and staff during this time. We wouldn't have been able to prepare our centers.
This meant everything to me, Monique. I really didn't know I would be without all of the help. I just love seeing my daughter happy. It really makes me feel great, just knowing that I could be able to put a smile on her face.